Bluebonnet Trails Community Services proudly operates 8 1115 waiver projects within Williamson County. Of these 8 projects, we share with you our expanded access, transitional housing, and extended observation unit, each positively impacting health outcomes in communities.
Our Expanded Access project provides an extensive array of outpatient behavioral health services to individuals living in low-income and rural areas in Williamson County. This project eliminates the barrier of the limiting, diagnostically driven population a community center is typically able to serve, so that an individual can come to us for services and we no longer have to turn them away because they don't have a particular diagnosis or global assessment of functioning. Our team consists of psychiatrists, advanced nurse practitioners, counselors, and peers, providing person-centered care around a philosophy of wellness and recovery. This project purposefully wraps around the continuum of care provided by Bluebonnet Trails and community healthcare partners to strengthen our collective impact in our communities. In the state of Texas, community centers are contracted to serve individuals with severe and persistent mental health diagnoses. What we found in community assessments is that there's a gap between the acute services provided by community centers and the care at medical homes with primary care physicians. We fill that gap with services that have no diagnostic restrictions. We fill that gap with peer-led services which honor the perspectives of those receiving services. We fill that gap through school-based healthcare. For example, at Hutto ISD, we have a team of medical and psychiatric professionals providing services to students, staff, and their families. We fill that gap with office-based services with telemedicine capability so that we can eliminate transportation barriers and increase access to healthcare. The continuation of 1115 funding continues a community partnership approach to addressing unmet needs in our communities. Now that we're able to provide a vast array of therapeutic services, schools and nursing homes and other entities are reaching out to us for the first time to provide services on their sites. We're excited to be able to be responsive and innovative in the way that we respond to those requests with same-day access to assessments, counseling and therapeutic services within 7 days, and medication management services within 14 days. Although the sustainability plans for each of our 1115 projects includes collecting fees for services, the majority of the people we serve are unable to afford the full cost of the service. While we're working with managed care organizations to increase value-based options on health plans, we do rely on 1115 funding for support. Without that support, our ability to meet the needs in our communities would be depleted.
Through our peer-led transitional housing project, we support a lease on a new life. Individuals with mental health challenges are referred from crisis services, the judicial system, inpatient settings, as well as the community. Our home offers an effective step-down option from the extended observation unit and crisis respite. The house provides a safe space where individuals are able to come and heal. Our program also provides suitable living space for multiple individuals in homes in our community. These homes are located near employment opportunities. As a peer specialist, we facilitate skills training to really improve the likelihood of an individual being successful as they transition back into the community. The goal is for every individual who comes through this house to really move forward with their lives and move into a permanent housing solution of their choosing. First and foremost in this project, we offer a safe living environment where individuals are able to really heal and not worry about where they're going to put their head at night, where they're going to get their next meal, that they're able to focus on their recovery, on their wellness. We provide 10 hours of peer services a week. These services range anywhere from Wellness Recovery Action Plan to WHAM, which is Whole Health Action Management, but mostly these peer services are all evidence-based practices coming from a place of strength. We also offer housing specialists. Individuals are receiving services with the housing specialist at least once a week, and the housing specialist works with them to look at what do they want, what kind of living environment do they want to move into, and what's it going to take to get there. We also provide employment services where an individual works with our employment specialist to look at what employment opportunities are out there, what may be their barriers. They work on applications together, they work on resumes. Whatever the individual needs, that service is there. Individuals are here at the program for up to 4 months. Without this program, individuals would end up back on the street, becoming a costly burden to the county. With this project, individuals get to move back into the community and become an asset, not a liability.
The 48-hour Extended Observation Unit, also known as the EOU, is a 4-bed unit designed to provide rapid stabilization for individuals experiencing a behavioral health crisis. It is the most intense level of care that Bluebonnet Trails provides for persons experiencing crisis in the community. The EOU allows us a safe and appropriate environment for rapid stabilization of individuals experiencing severe psychiatric symptoms. It offers a safe and secure place for the Extended Observation Unit, diverting individuals from hospitalization or even unnecessary incarceration. The EOU admits individuals on a voluntary basis that are seeking emergency stabilization or those that are admitted involuntarily on an emergency detention warrant from a peace officer. The EOU also allows for rapid access to crisis assessments by licensed professionals, as well as psychiatric evaluations from psychiatrists, so treatment can start within the first hour of admission. We work closely with the crisis intervention team and the mobile outreach team throughout the admission process. Once admitted to the EOU and stabilization occurs, we work with the individual to link them with the appropriate aftercare services. Through the EOU, we reduce admissions and usage to the emergency departments, diverting individuals to the appropriate care when they need it. We also support law enforcement, providing immediate access to psychiatric evaluations so that we are not unnecessarily tying up peace officers. We also serve as a step-down option for individuals that are on the cusp of discharge from the state hospital, providing them with transition back into the community through the EOU and opening up valuable state hospital beds. Lastly, we provide linkage for our individuals into transitional or ongoing services and assisting them in their journey towards recovery. We find that if the EOU was removed, Williamson County would see more usage of the emergency departments and more time spent by peace officers trying to find the appropriate treatment for individuals in crisis. Furthermore, these individuals in crisis, when they present to the ER, they may wait days to be able to access psychiatric inpatient hospital beds, and thus tying up the emergency departments for individuals from the community seeking medical treatment. We would not have the capacity to help with step down from state hospital, therefore tying up those scarce resources. And lastly, our individuals could be arrested instead of receiving behavioral health services, and therefore add an additional barrier to them achieving stabilization and recovery.
It takes a collaboration between community partners to develop a strong continuum of care, resulting in healthy Texans. Through these projects, Bluebonnet Trails Community Services partners to offer expanded and innovative services, successfully improving access to cost-effective care, improving the quality of care, and improving the overall health and functioning of individuals in our communities.